So dear friends, we are going to discuss Apocyanum from Synoptic Key. See, in the Synoptic Key, he has given first the regions of action. Very important, where exactly the site of action. It defines the sphere of action. So what he says, it is given in bold as well as in capitals. That means it has very marked action on urinary organs. Then he has given in bold heart and digestive tract, and in common Roman uterus. So marked action of the apocyanum is always on the urinary organs. Generally, it is considered to be a organ remedy, very specific organ remedy. If you compare it with Apis, Apis is constitutional remedy. Apis has action, wide action on all the organs, all the system. Whereas Apocyanum is very specifically located its action on the urinary organs. See the modalities. Modalities are cold weather aggravates, cold drinks aggravates, and uncovering, lying down. But here he has mentioned the cold in capitals. So it means that patient is always a chilly in case of apocyanum. Then he starts with bold, weak and dropsical, and this itself suggests that these are the people who are absolutely weak at the same time having a dropsy, and this is more specifically for renal dropsy. Scanty discharges, there is irritation, bewildered, can't think, faint, thirst but water distresses, vomits every day. So see, this is again one important thing which one must learn. They cannot think properly. Their state is of embarrassed nature. That is more because of its renal failure state. There is fainting which develops because of it. There is thirst, but even thirst is there. But water, whenever the patient consumes water, it distresses the patient. Vomits every day, and this vomiting is typical of a uremic vomiting, uremic headache, uremic vomiting. So blood urea, when it has been too much increased and vomiting has started, this is typical of uremic vomiting. Sinking and epigastrium, noisy, yellow, painless, gushing stools. So GI tract action is there. This is secondary to urinary complaints associated with dropsy, with diarrhea with dropsy. Bedwetting of old men, that is another characteristic. Very specifically mentioned, whenever bedwetting is there with the old men, then you think about the apocyanum. Enlarged prostate, and that bedwetting is because of the incomplete urination. There is post-void urine is always in large quantity in those enlarged prostate patient, and because of which during sleep the bedwetting happens to be there. It is not completely evacuated. Uterine hemorrhages, then dropsy, like angina. Operation of chest, so there is a little bit embarrassed feeling, breathless sensation. Rough, dry skin, so skin, the dryness happens to be there. Can't sweat, so there is no sweat. Sleepiness, pulse is slow, fluttering, irregular and intermittent. Secondary effect of the renal dropsy happens to be there on the cardiac output, and that's why the pulse becomes slow, it is fluttering, it is irregular and it is intermittent. But it is not primarily the disease happens to be there in heart. Primarily it happens to be there with the kidneys, and then it has been transmitted to the heart. So relationships, the two remedies he has mentioned over there, relationship China, Ars and Natsumika. But apocyanum should be compared with Apis, and that already we have done.